Congress does not get a spending bill passed in the next 12 hours, it is not only the government that shuts down, of course. Starting tonight, many of the 9 million children who depend on CHIP, the Children's Health Insurance Program, will lose their coverage. Joining me now is Mark Shriver, Vice President and Managing Director of Save the Children USA. Mark, thanks for being with us. I don't have to tell you that we are at the height of flu season, one of the worst flus we've seen. Children are dying. People are in ERs. And the government could potentially shut down, and all of these kids would not be covered.
And it's an amazing, popular, bipartisan program started 21 years ago by Senator Kennedy and Senator Hatch. I mean, Senator Hatch said in '97 that we had a moral obligation to our children, most vulnerable children, and we're 21 years later using this as a big bargaining chip, as we just heard from Garrett on Capitol Hill. It's outrageous. I mean, and the bottom line is that kids, poor kids, don't have access to the political system, and they've been pushed aside. They don't vote, they don't give money, and both Republicans and Democrats have let this happen. I mean, it's the 4th time we've had a CR. It's crazy, right? And the fact that we're negotiating around children's health and pregnant mothers is really outrageous. And I don't think anything's going to change until the people stand up and tell leaders of both parties that this has got to stop.
I mean, we remember the days when your uncle Teddy Kennedy would be negotiating with Orrin Hatch and coming up with health and education programs and jobs programs. He would be negotiating, in fact, with Dan Quayle.
Yes. I mean, and that sense of bipartisanship seems to have passed by Washington. And I think people outside the Beltway are just appalled by it. And the fact is, it's not only CHIP, but there's another program called the Maternal, Infant, Early Childhood Home Visiting Program, which is $400 million, which has bipartisan support again, which is not being renewed either. And that's for young children 0 to 5 to get home visiting. That's been shown through results to have a profound impact on kids and families. But somehow kids and families that don't have money, don't have resources, don't have a voice in Washington. It's really a terrible situation.
But they've got money to take the entire cabinet, practically, to Davos, Switzerland.
Yeah, I heard that comment. I mean, that's really unbelievable, right? I mean, they're talking about going to Davos and not renewing Children's Health Insurance Program, taking care of pregnant women in this country, taking care of our most vulnerable little citizens. It's a bad state of affairs, and I think people have got to get off their butts and get engaged. And that's what the political process is. I mean, it's that line from Teddy Roosevelt, right, about the credit belongs to the person in the arena. And I think we need more people in the arena getting fired up, protesting in Washington and in their state capitals and demanding action.
Mark Shriver, thank you very much. A busy news day here. More ahead. We'll be right back.